Hello students, I am Dr. Vaishali Bharambe, Professor Anatomy. Many times students approach me with a question, how to study muscles of forearm, the flexors as well as extensors. Now you can see that I have displayed bones on the screen. Understand that it is the bones which help you to study the muscles of forearm, that is study of osteology. How do they do that? Know the bones. Next, draw the muscles on the bones at the attachment. Where is the origin? Where is the insertion? Just draw it and you will be surprised at how easily you know the muscles of forearm. Come, let's try that. Let's learn about the muscles of the anterior compartment of the forearm, the flexor muscles. The flexor muscles are divided into superficial group and a deep group. So this is the superficial group, okay, and here is your deep group. The superficial muscles are the following, okay. They're all the ones that take origin from the common flexor origin. They are pronator teres, flexor carpi radialis, so easy to add the flexor carpi ulnaris here, palmaris longus, and the flexor digitorum superficialis. Let's now add the deep group of muscles. The deep group of muscles are flexor pollicis longus, flexor digitorum profundus, and pronator quadratus. These are the muscles we are going to now remember, put in our brain, and the next step is that we begin to draw them. Okay, so if you got these in your brain, let's begin to draw these muscles. But before that, let's draw the bones. Okay, so I'm going to draw the humerus here, the lateral epicondyle, the medial epicondyle, the capitulum, and the trochlea. Now add to this the radius, the radial tuberosity. I'm going to draw it a little short because I also would like to draw the hand in this diagram. So that completes the radius. Now let me add to this the ulna. Okay, so that's your ulna, articulated with humerus at the back. Now let me add the carpals: scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Now the metacarpals: 1, 2, 3, 4, 5. 2 phalanges here and 3 here. Now it's important that you remember that there are 3 here because we're going to add muscles to them. Okay, now let's now draw the first muscle here. This is your pronator quadratus, the deepest of them all. Okay, draw it nicely. Now, as we draw, we're going to keep coloring so that the muscles have their own individual identity. So that's my pronator quadratus. Now, on to the next layer. Here's your flexor pollicis longus, descending across to the base of the distal phalange. And here's your flexor digitorum profundus. See how this is also going to the base of the distal phalange. That's the first tendon, that's the second tendon, that's the third tendon, and here's the fourth one. Okay, with this in place now, we're going to color them. Okay, so flexor pollicis longus, flexor digitorum profundus. You got your deepest set of muscles ready. Now what are we going to do? In this set of bones, we're going to add the superficial muscles. Okay, so let's begin to add the superficial muscles, starting with flexor digitorum superficialis. The earlier one that we drew was flexor digitorum profundus. Now I am drawing flexor digitorum superficialis. Observe how this extends only till the base of the middle phalange. It does not extend down to the distal phalange. Okay, and that's the lesson we need to learn here, that flexor digitorum superficialis is shorter than flexor digitorum profundus. Okay, having drawn it, let us color it. So that's the muscle. Now understand that above it, medial to it, lateral to it, there are other muscles which we are now going to add to this diagram. Now medial to it, extending along the ulnar side, is the flexor carpi ulnaris. Okay, and extending onto the other side is your flexor carpi radialis. Okay, and in between the two, here is your palmaris longus. Remember, in case of palmaris longus, the belly is small and the tendon is long. Okay, now let's begin to color each of these muscles. Remember, there has to be a contrast. Otherwise, you will not be able to identify individual muscles. So that's my palmaris longus, flexor carpi radialis, and the flexor carpi ulnaris. Now the only muscle left to be drawn is our pronator teres. So the pronator teres travels across like this. If you recall, it forms the medial boundary of the cubital fossa. Let's color the pronator teres as well. Okay, this is how simple it is to draw all the muscles of the forearm. Let's now perform the last exercise, which is labeling them. Let's begin by labeling the bones, the humerus, the radius, and the ulna. Okay, label the muscles now. Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. And deep to them here is your flexor digitorum superficialis. Now on the other side, again this is your humerus, your radius, and your ulna. Deepest here is your pronator quadratus. This is your flexor pollicis longus. And this here is your flexor digitorum profundus. Of course, note distal phalange. For this side, note middle phalange. Right. So these are deep. These are superficial. These are all muscles of the anterior compartment of forearm. This is how easy it is to remember muscles of forearm if you draw them on the bones. So knowing your osteology is important. Now let's talk about the extensor group of muscles or muscles of the posterior compartment of forearm. Posterior compartment of forearm or extensor group of muscles. Okay, so we're going to divide the extensors again into superficial group of muscles and a deep group of muscles. Let's now write down which are the superficial. The superficial group of muscles include the anconeus, the extensor carpi radialis longus, extensor carpi radialis brevis, brachioradialis. These three actually are the lateral group of muscles, okay? Now the rest. extensor carpi ulnaris, extensor digiti minimi, extensor digitorum. Now let's talk about the deep group of muscles. The deep group of muscles are supinator, extensor pollicis longus, extensor pollicis brevis, and abductor pollicis longus. Finally, let's add extensor indicis. So superficial are 1, 2, 3, 4, 5, 6, 7. Deep are 5, a total of 12. That's a lot of muscles, but easily remembered if you draw them. Okay, so let's begin to draw them. Now I'm going to draw first the humerus as seen from the back. Okay, so now remember, this is your medial epicondyle, very prominent, lateral epicondyle, the trochlea, and the capitulum. We're going to first draw the ulna, styloid process, head of ulna. Now we're going to draw the radius, radial tuberosity. We're not drawing these bones very large because we also need to put our hand in here. So scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Now let's add the metacarpals. 5, phalanges, 3, 3, 3, 3, and 2. There you got your hand in place now. Now let's begin to add the muscles. Okay, so the first muscle I'm going to draw is an anconeus, Okay, although it is superficial, I'm drawing it with the deep because it is better visualized this way. It becomes very difficult to draw otherwise. So that is your supinator. Now let's add the muscle that takes origin from both the bones and descends down. That's your abductor pollicis longus, accompanied by your extensor pollicis brevis. Taking origin from the ulna and again traveling towards the pollex is your extensor pollicis longus. And finally, from the ulna towards your index finger is your extensor indicis. Now, once we color these muscles, you will be surprised how easily you will understand them. So, let's begin to color. Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis, supinator, and anconeus. All the muscles seen so quickly and so easily. What's the next thing we will do? We will draw the superficial muscles in a parallel diagram. Let's now draw the superficial muscles here. Remember, the superficial muscles take origin from common extensor origin, okay? And some from lateral supracondylar ridge of humerus. So here from lateral supracondylar ridge descending down is your first muscle, the brachioradialis, accompanied by the extensor carpi radialis longus and then extensor carpi radialis brevis. These three muscles are part of the lateral group of muscles. Okay, so let's color them. Brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis. Now let's draw the rest of the muscles. Okay, so from the common extensor origin towards the ulna, extensor carpi ulnaris. Towards the digiti minimi, extensor digiti minimi. And then Extending towards the digits forming 4 tendons is your extensor digitorum. Of course, you should not forget that this is the same muscle that results in formation of the digital expansion, dorsal digital expansion. Let's now color these muscles as well. Extensor carpi ulnaris, extensor digiti minimi, and here is your extensor digitorum. So you've got all the muscles in place now. Let's begin to label them one last time for you to be able to have a better recall. Again, we will first label the bones. The humerus, the ulna, and the radius. The humerus, the ulna. Okay, let's begin to label the muscles. The lateral group. The brachioradialis. Extensor carpi radialis longus. Extensor carpi radialis brevis. Extensor carpi ulnaris. Extensor digiti minimi. Extensor digitorum. All muscles quickly labeled. Now deposit. Of course, we know that anconeus is part of the superficial muscles. Anconeus, supinator, the abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, extensor indicis. These are mostly deep group of muscles. These are superficial. This is how you remember muscles in the posterior compartment of forearm. Please practice using your bones, drawing the muscles, and it is very likely that you're not going to forget these muscles.
Students, I hope that you liked this lecture, and if you did, then do please like, share and subscribe to my channel and hit that bell icon. Students, for detailed anatomy lectures with diagrams, surgical anatomy videos, downloadable notes, MCQs, please do visit my website www.vbanatomy.com. Link is in the description section. I want to request you to please share your comments in the comment section. That way I will know whether all these efforts of mine are really helping you in your journey in anatomy. Okay, so all right, this is it for today. I'll see you in my next lecture. Thank you.